Imagine a threat that can quietly devastate an entire industry without a single visible sign in some of its key players. Sounds about like a spy novel.
Yeah, it kind of does.
But for, the multi-billion-dollar equine breeding world, this isn't fiction. It's actually a very real and very serious challenge.
Absolutely.
So today, we're doing a deep dive into something called Contagious Equine Metritis, or CEM. It's a bit of a mouthful, CEM.
It is.
But understanding it is absolutely critical for anyone involved with horses, especially, in breeding.
For sure. And we've gathered a whole stack of detailed sources on CEM, and our mission really for this deep dive is to kind of distill the most important nuggets of knowledge for you.
Okay.
We'll explore exactly what CEM is, how this insidious disease spreads, the really surprising ways it affects mares versus stallions, very different.
Right.
The intricate process of diagnosing it, which is frankly harder than you might think, and then the very strict, almost military-like protocols for treatment and prevention.
And I think you'll quickly understand why this is considered a foreign animal disease in places like the United States, and why, immediate reporting of any suspected case is just absolutely vital for protecting the entire equine industry.
Mm-hmm.
So let's unpack this. What exactly is contagious equine metritis?
Okay, so at its core, CEM is a highly contagious venereal disease, primarily affects horses.
Venereal.
It's caused by a specific bacterium called Taylorella equigenitalis. Now, what's really interesting, or maybe tricky here, is that it's non-life-threatening.
So it doesn't kill the horse?
No, it won't kill a horse. But, and this is the kicker, it causes temporary infertility in mares and, crucially, asymptomatic carriage in stallions. They show no signs.
Uh-huh.
And it doesn't cause like a systemic illness throughout the body. It's strictly confined to the reproductive tract.
So it's not killing horses, but it's causing infertility. That alone sounds like it could be a devastating blow to a breeding operation.
Oh, absolutely.
Why is it considered a foreign animal disease here in the U.S. then?
Exactly right on the infertility point. Temporary infertility means huge economic losses for breeders. And it's designated as a foreign animal disease in the U.S. precisely because it's not endemic here. It's not normally found.
Okay.
Which means if a confirmed case pops up, it must be reported immediately. State, federal, animal health authorities, everyone gets alerted.
It's like a full-scale response.
It is. It's a full-on alert because the aim isn't just control, it's complete eradication, because of that economic threat.
Okay. So with a pathogen this elusive, how does it actually move through the equine world? How does this unwelcome guest spread?
Well, the primary way, the most efficient method is direct venereal contact.
Okay, so breeding.
Yeah, infected stallions transmit it to mares during live cover breeding.
Mm-hmm.
And interestingly, mares can also transmit it back to stallions.
Oh, really? Okay.
Yeah, but here's where it gets, really interesting beyond that. It's
Yeah.
not just about direct contact. Artificial insemination, AI, that's a significant vector too.
Yeah.
Contaminated semen, whether it's like fresh, chilled, or even frozen if it hasn't been processed correctly, can carry the bacteria.
So even with modern breeding techniques, it can still spread. What about indirect methods, like things?
Right, exactly. That's where fomites come in.
Yeah.
That's the technical term for inanimate objects that can carry the bacteria.
Okay.
Think about contaminated instruments like breeding phantoms, artificial vaginas, semen collection gear, even examining gloves, speculums,
Wow.
tail wraps, or even just the hands of handlers. If stuff isn't meticulously cleaned and disinfected between horses, they can easily spread CEM.
That's a lot of potential sources.
It is, and it gets even more complex. Foals born to infected carrier mares can actually pick up the bacteria during birth.
From the mother.
From the mother, yeah. And then they can become carriers themselves once they mature. And while it's pretty rare, stallion-to-stallion transmission can even happen through contaminated equipment at semen collection places.
So basically, every surface, every tool, every touch is a potential point of transmission if you're not careful.
You got it. That's why the biosecurity has to be so intense.
Wow. That is an incredible level of detail needed. But you mentioned the real sort of cunning of CEM is how differently it targets mares versus stallions, like two different diseases.
Yeah, that's a good way to put it.
Let's start with the mares. What stands out about how CEM affects them?
Okay, so for mares, The bacteria, Taylorella equigenitalis, primarily infects the lining of the uterus, that's the endometrium, along with the cervix, the vagina, and the specific areas on the outside called the clitoral fossa and sinuses.
Right.
So after breeding with an infected stallion, clinical signs typically show up pretty quickly, within maybe 2 to 14 days.
Good.
The bacteria multiply really fast, causing inflammation in those areas, endometritis, cervicitis, vaginitis. And this inflammation, well, it makes it incredibly difficult for the mare to conceive. That's the infertility.
Right.
And often you'll see mares returning to heat or estrus much sooner than expected. We call that short cycling.
And what are the actual, like, physical signs a mare owner might see that would make them think, huh, maybe something's wrong?
Well, the most characteristic sign, although it's only present in maybe 30 to 40% of infected mares, is a mucopurulent vaginal discharge.
Okay, what does that look like?
It can range, from kind of watery to really thick and creamy, maybe grayish white. It might even mat the hair around the tail, but typically it's odorless.
Okay.
But honestly, the primary thing most owners will notice is just plain infertility. Mares just fail to conceive, or they do that short cycling thing.
The discharge isn't always there.
Not always, no. And other subtle signs, maybe fluid in the uterus, you'd see on an ultrasound. And while it's rare, abortion has actually been reported in some cases, usually mid to late gestation. But here's where it gets really insidious for mares. A significant number of them, even if they're untreated or maybe after those initial signs disappear, they become asymptomatic carriers.
So they look fine, but they're still infected.
Exactly. The bacteria just kind of hang out, primarily in those clitoral fossa and clitoral sinuses, sort of hidden away. These mares show absolutely no obvious signs, but remain a silent source of infection for future breedings for months or maybe even longer.
Wow.
They basically become mechanical carriers, potentially contaminating anything that touches those areas.
That sounds like an absolute nightmare for a breeder. A mare that looks perfectly healthy but is silently spreading disease.
It really is.
So, if mares can be silent carriers, what about the stallions? You called them the silent but dangerous ones earlier. What does this all mean for them?
Right. Stallions are almost always, and this is really crucial, asymptomatic carriers.
Completely asymptomatic.
Almost completely. They show absolutely no clinical signs. None. No discharge, no inflammation, no obvious drop in their own fertility.
Wow.
And this silent carriage is precisely what makes them such incredibly efficient transmitters of the disease to mares.
Oh.
Totally undetected.
So where do the bacteria live on them?
They colonize the external genitalia, particularly places like the urethral fossa, the urethral sinus, parts of the penis, the prepuce, the folds in there. They can even be present in the pre-ejaculate fluid and in the semen itself.
So unlike the mares, they don't really produce an immune response we can detect easily. Their bodies don't even, raise an alarm.
Exactly. That's a key difference. Stallions typically don't produce detectable systemic antibody responses because the contamination is just... it's a surface thing. It's just colonization of the external parts. There's only one single reported case where they found it deeper in the testes at necropsy. But for all practical purposes, it stays on the surface.
Which
means their body doesn't usually mount that full-blown systemic immune response that we could pick up with a standard antibody blood test.
That makes sense. Given how incredibly sneaky CEM can be, especially in these stallions showing no signs at all, how on earth do veterinarians even begin to diagnose it? This sounds incredibly challenging.
It is incredibly challenging, and the diagnostic process is consequently very, very stringent precisely because of this stealthy nature.
Right.
And remember, CEM is a reportable disease globally, so strict testing protocols are mandatory. Now, clinical suspicion usually starts with the mares, right? Unexplained infertility.
Especially if she was bred to a new stallion or one from overseas.
Exactly. Bred to an imported or maybe an untested stallion, or if she shows that specific vaginal discharge we talked about.
Okay.
For stallions, though, there are no clinical signs. So suspicion only really arises if the mares they've bred develop CEM. It's often a reactive thing, tracing it back.
So it's like playing detective, tracking back to the source stallion.
Pretty much, yeah.
How do they even get useful samples from these animals given how tricky the bacteria is?
Well, proper sample collection is absolutely paramount. This bacterium, Taylorella, it's what we call fastidious, meaning it's really picky, hard to grow in a lab. So for mares, you need swabs collected from multiple key spots.
Yeah.
Both inside, like the cervix or uterus lining, ideally when she's in heat, and outside from those clitoral fossa and sinuses.
Multiple spots.
Multiple spots. And for stallions, swabs are taken from the urethral fossa, urethral sinus, the prepuce, including all those folds, and the opening of the urethra. You can also sample pre-ejaculate fluid or semen sometimes.
And then getting into the lab quickly is key.
Absolutely critical. What happens immediately after is vital. These swabs must go straight into a special transport medium, Amy's charcoal medium usually. Then they have to be kept refrigerated like 4 to 6 degrees C and rushed to an approved diagnostic lab within 48 hours, max.
Wow, 48 hours.
Yeah, to keep those delicate bacteria alive. And definitely do not freeze them. Freezing kills them.
Right. And once the samples get to the lab, what are the sort of the official validated tests they're running?
Okay, so the bacterial culture is still considered the gold standard.
Growing the actual bacteria.
Yep. The swabs are put onto specialized growth media, like chocolate agar, under very specific conditions, microaerophilic, meaning low oxygen, about 5–10% CO2, and exactly 37 degrees Celsius.
How precise?
Very. And Taylorella equigenitalis is slow growing, so the lab plates have to be incubated for at least 7 days before they can confidently say it's negative.
A week.
A whole week. And because the bacteria are so elusive, and you often get other common bacteria trying to grow on the plate too, you usually need multiple cultures from those multiple sites we talked about, often taken over several days, to get a definitive diagnosis.
Okay. Culture's the gold standard. What else?
Then there's real-time PCR. This test detects the bacteria's DNA directly.
Faster, I bet.
Usually faster, yes, and generally more sensitive than culture alone. It can even tell the difference between the CEM bacteria, T. equigenitalis, and a non-pathogenic relative that sometimes pops up, Taylorella acidogenitalis.
Oh, interesting.
Yeah, so it's often used alongside culture, or sometimes even instead of it, depending on the specific country's regulations. But it's important to note it's not considered sufficiently validated yet for screening things like cooled or frozen semen and embryos, still mainly for swabs.
Okay. And what about those antibody tests for mares? You mentioned stallions don't make antibodies, but do they help with mares?
They can, sometimes. For mares, we can use serology, specifically a test called the complement fixation test, or CFT. This looks for antibodies in her blood serum.
And when do those show up?
Usually around 3 to 7 weeks after she gets infected, say 21 to 45 days. But, and this is a big but, there are significant limitations.
Like what?
Well, first, it's only useful for mares because, like we said, stallions don't reliably produce detectable antibodies.
Right.
Second, a positive CFT just tells you the mare has been exposed at some point. It indicates her body saw the infection. It doesn't confirm she's actively infected right now or if she's become one of those silent carriers.
Ah, I see.
And some carrier mares might even have antibody levels that are too low to detect, or they might fade over time. So you really can't use it as a standalone test for diagnosis, or, crucially, for deciding if a horse is clear to be released from quarantine.
Okay, so it's a piece of the puzzle, but not the whole picture for mares. So if you suspect a stallion, and culture is tricky, and blood tests don't work, how do you really confirm he's clear? Especially if he's imported or something.
Right. That's where test breeding comes in. This is often used as an adjunct to culture, especially for imported stallions, basically to boost the chances of detection.
How does that work? Sounds intense.
It is. After the stallion has already gone through a series of initial negative cultures, say 3 sets over a week, the suspect stallion is then bred, usually live cover, to 2 or sometimes more certified CEM negative mares. These are the test mares.
Okay.
These test mares are then watched very closely. They're serially sampled and tested themselves using both bacterial culture and that CFT blood test.
To see if they catch it from him.
Exactly. The thinking is if the stallion is a silent carrier, breeding him to these susceptible mares gives the bacteria a chance to multiply in the mares, making it much easier to detect than just trying to find it on the stallion directly.
Clever, but complicated.
Very. The mares are assessed with repeated PCR and culture swabs, and you also look for seroconversion, meaning they develop those CF antibodies in their blood, usually between that 21 and 45-day window. It's a comprehensive, time-consuming, and expensive process, but it really underscores just how difficult it can be to be absolutely sure you've found this hidden threat in stallions.
Okay, so once this silent enemy is identified, finally the battle begins. What does that actually look like? How do you treat CEM and, maybe even more importantly, how do you prevent it from spreading in the first place?
Right, so the goal of treatment is complete elimination, eradication of the bacteria from that animal. And it's strict. All suspected or confirmed CEM-positive horses must be quarantined under federal or state supervision until they are successfully treated and confirmed negative through testing. No exceptions.
Makes sense. What's the treatment for mares?
For mares, it involves a really rigorous topical washing of the external genitalia, especially focusing on those tricky areas, the clitoral fossa and sinuses. They're thoroughly washed, really scrubbed, with a specific antiseptic solution, usually 2% chlorhexidine or sometimes povidone iodine,
And how often?
vigorously for 5 consecutive days. The goal is to physically remove all the smegma where the bacteria love to hide.
Okay, that sounds like an intense process for the horse and the handlers. What else?
Yep. Then, after rinsing off the antiseptic wash, a specific topical antibiotic ointment, something like nitrofurazone or silver sulfadiazine cream, is applied directly into those same areas, the clitoral fossa and sinuses. Also daily, for those same 5 consecutive days.
So washing and packing with antibiotics.
Exactly. And for mares that have an active uterine infection, what we call acute infection, the uterus itself might also be infused with an appropriate antibiotic, maybe penicillin or ampicillin. Sometimes systemic antibiotics given by mouth or injection might be used too.
Is that usually enough?
Usually, yes, but in very rare, really persistent cases that just don't clear up, surgical removal or ablation of those clitoral sinuses might be considered as a last resort, but that's very uncommon.
Okay. And for the stallions, the asymptomatic carriers, what's their treatment protocol? Is it similar?
It's similar in principle, focusing on the external areas where the bacteria live. For stallions, the entire penis, ideally when it's dropped and extended, and the prepuce, including all those folds and the urethral fossa, are thoroughly scrubbed daily for 5 consecutive days with that same 2% chlorhexidine solution. Again, making sure all the smegma is removed.
5 days of scrubbing.
5 days. And then, after drying, a similar antibiotic ointment, nitrofurazone or silver sulfadiazine, is applied liberally to all the treated areas.
And then it was the retesting, I assume.
Absolutely critical. The post-treatment testing is key for getting official clearance from quarantine. Horses have to go through a very strict retesting protocol. Usually there's a specified rest period, maybe 21 days, after the very last antibiotic application before they even start re-swabbing and culturing again.
To make sure the antibiotics are gone and not just suppressing the bacteria.
Precisely. And then they need multiple sets of negative cultures taken at specific intervals to be declared clear. The exact protocol varies, but for instance, the USDA FIS protocol in the US is very thorough. Mares need 3 negative culture sets taken during 3 consecutive estrus periods.
Wow. That could take months.
It can, and stallions need 3 sets of cultures taken frequently, like every couple of days, followed by negative results from that test breeding procedure we discussed earlier.
Okay, this sounds like an absolutely enormous undertaking, both the treatment and the testing.
It is.
So how does the industry try to avoid CEM entirely, given all this effort? Prevention must be huge.
It absolutely is a lot of work, and you're right, prevention is paramount. Number 1 is strict import regulations. Most countries, definitely including the US, have really stringent requirements for horses, especially breeding stock, coming from regions where CEM is known to exist.
So testing before they even leave.
Exactly. Pre-export testing, then often quarantine upon arrival, and then more post-import testing before they're fully released.
Okay. What else?
Pre-breeding testing is also highly recommended, even for domestic horses. Annual prophylactic testing of active breeding stallions is a really good idea. And certainly, any mares showing infertility or discharge, or any mare that's been bred to an untested stallion should be tested.
That makes sense.
And then there's just strict biosecurity at breeding facilities. This is non-negotiable, basic hygiene, but taken to a high level. Using disposable gloves for each individual mare and stallion examination or procedure.
Changing gloves every single time.
Every single time between horses. Thoroughly cleaning and disinfecting all breeding equipment. Artificial vaginas, speculums, collection bottles with effective disinfectants, preferably sporicidal ones. Using disposable AI pipettes and equipment whenever possible is also a big help. And keeping meticulous, accurate breeding records is vital for traceback if an infection does occur.
And isolating suspicious cases immediately.
Immediately. Any horse even suspected of having CEM should be isolated right away. And any suspected or confirmed cases must be promptly reported to the state or federal animal health authorities. That reporting is key to containment.
Is there a vaccine?
Unfortunately, no. Currently, there is no effective vaccine available for CEM. Research continues, but nothing effective is commercially available right now.
So it really comes down to testing, hygiene, and reporting.
That's the triad, yes. Testing, biosecurity, and rapid reporting response. The good news is, though, with the right treatment and strict adherence to these protocols, recovery is the expected outcome. horses can be successfully cleared of the infection.
Wow, that was a truly, truly deep dive into CEM. It's just remarkable how a tiny, non-lethal bacterium can cause such significant problems for an entire global industry, particularly how silently it operates in stallions.
It really is.
It's a real testament, isn't it, to how a seemingly minor biological factor can have just massive economic ripple effects.
Indeed. CEM remains a serious challenge, no doubt about it, for the equine breeding industry, purely because of that high contagiousness, and, as you said, the asymptomatic nature in stallions. Effective control relies entirely on that strict adherence to testing, really diligent biosecurity, and just a rapid response to any suspicion.
Yeah.
It really underscores the constant vigilance that's needed in animal health, especially with international movement of animals.
For you, our listener, I think what really stands out about CEM is just how critical these invisible threats can be. Whether it's, in an animal population like this, or maybe an economy, or even just a hidden flaw in a complex system somewhere.
That's a great point, and it really brings up a crucial question, doesn't it? What lessons does this whole story of contagious equine metritis offer us about the broader importance of, well, unseen surveillance and these really stringent protocols, not just for protecting animal health, but also, as we've seen, economic stability, even when the threat itself might not announce its presence with, obvious flashing warning signs or symptoms?
Yeah. Something to mull over as you go about your day.